So today we'll be talking about gestational diabetes. So the definition of gestational diabetes is glucose intolerance with its onset during pregnancy, usually around the 24th week or first detected in pregnancy. So who's at risk and some risk factors? So mothers with a history of glucose intolerance or diabetes prior to getting pregnant. Mothers who are older than 35 years old, mothers who are overweight, who have a history of diabetes in the family, a history of poor obstetric outcomes, meaning like fetal demise or issues within her previous pregnancies. They come from a racial group with high prevalence of diabetes. They have a history or currently have hypertension. They have a BMI greater than 30, and they currently have PCOS or polycystic ovarian syndrome. So some signs and symptoms are proteinuria, which is protein in the urine, blood pressure changes, dry mouth, frequent urination, feeling tired, flushed, headaches, and drowsiness. Some complications to gestational diabetes include hypertension, hyperglycemia, hypoglycemia, the risk of a C-section, a large infant, and they run the risk of having to be induced early. So some nursing diagnoses are risk for altered nutrition, less than body requirements, risk for maternal injury, risk for fetal injury. So some management, the one I decided to focus on was nutrition management. They want to maintain a balanced glucose level while providing enough energy and nutrients, while also avoiding ketosis and minimizing the risk of hypoglycemia. They can do this by consuming 40% of their calories from good quality complex carbs, 35% of their calories from protein, 25% of their calories from unsaturated fats. They can do this by having small frequent feeds, bedtime snacks, and to include protein and fat at every meal. So some nursing interventions. We want them to take their blood sugar every 4 hours and before meals and before bed. Wear a diabetic bracelet just in case you don't want to be having an emergency and nobody knows why. Carry what they call glucose boosters, so something with carbs and sugar in them. They could be small snacks, hard candies. We want mothers to engage in exercise, consume 8 8-ounce glasses of water daily. We want to inform them to wash their hands frequently to avoid illness, because them getting sick while pregnant can also affect their blood sugar. So some pharmacologic treatments are glyburide, metformin, insulin lispro, insulin aspart. Not every woman with gestational diabetes needs oral hypoglycemics or insulin. This is just, if it were to get to that, a lot of treatment is within nutrition.